The high cost of insulin and other medications are major issues for many people with diabetes, and there are a number of approaches to bringing down the price. We need to talk about mainly three things. 1. Policy changes, patient assistance programs. 2. Doctors' role in suggesting alternatives and generics rather than brand-name products. 3. Educate the patient about other ways of lifestyle changes and reducing the carbohydrate intake. I believe reducing carbohydrate intake can play a major role in reducing the medication cost. Policy changes, patient assistance programs. We need to break the duopoly, oligopoly, or monopoly with regard to medication. The situation is very bad when it comes to insulin. Limit out-of-pocket costs for patients with diabetes. This could involve capping co-pays at a set amount, providing first-dollar coverage, where insurance covers the cost from the beginning, or limiting monthly costs. Increase transparency in the pricing of insulin. This would allow for a better understanding of how much it costs to produce and distribute insulin and could help to identify areas where savings can be made. Encourage competition in the insulin market. This could involve supporting the development of biosimilar insulins, which are cheaper versions of brand-name insulins. Improve existing programs to be less restrictive and easier for patients to access. Consider eliminating copay savings cards in favor of true cost reductions. Ensure that patients are paying the lowest possible price for insulin, taking into account all discounts negotiated by different players in the healthcare system. Insulin cost capped in America. As part of President Biden's historic Inflation Reduction Act, nearly 4 million seniors on Medicare with diabetes started to see their insulin costs capped at $35 per month this past January. This will save some seniors hundreds of dollars for a month's supply. But in his State of the Union, President Biden made clear that this life-saving benefit should apply to everyone. It should not be limited to just Medicare beneficiaries. Recently, Eli Lilly, the largest manufacturer of insulin in the United States, lowered their prices and met that call. Eli Lilly announced they are lowering the cost of insulin by 70% and capping what patients pay out of pocket for insulin at $35. This action, driven by the momentum from the Inflation Reduction Act, could benefit millions of Americans with diabetes in all 50 states and U.S. territories. The President continues to call on Congress to finish the job and cap costs at $35 for all Americans. Additionally, the Biden administration is targeting the blood thinner Eliquis, diabetes treatment Jardiance, and 8 other medications for Medicare's first-ever drug price negotiations as it seeks to lower medical costs for Americans. President Biden has also called on Congress to extend a monthly cost limit on insulin to all Americans. Currently, insulin costs are capped at $35 a month for people on Medicare, but that out-of-pocket cap does not extend to younger Americans who directly purchase their own health insurance or get coverage through an employer. As we work together to fight diabetes, the Biden administration will continue to build on the Affordable Care Act, or ACA, and strengthen the coverage it provides for nearly 2 million American adults with diabetes. It's essential to address the high costs associated with diabetes management and ensure access to affordable medications for all individuals affected by this condition. Hopefully, this will soon flow to other countries. Doctors can play a significant role in helping patients manage medication costs. Here are some strategies doctors can use. Open communication. Initiate a conversation with patients about affordability concerns. Let them know you're willing to work with them to find cost-effective solutions. Generics first. Prescribe generic medications whenever possible. Generics are typically far less expensive than brand-name drugs and offer the same effectiveness. Therapeutic alternatives. Consider if there are alternative medications from the same class that might be more affordable, even if they're not generics. Review medication necessity. Regularly assess if a patient still needs all their current medications. Sometimes medications can be discontinued or dosages adjusted as conditions improve. Dosage optimization. Ensure the prescribed dosage is appropriate and not exceeding what's necessary. This can help reduce medication waste and overall cost. Extended prescriptions. When appropriate, consider issuing longer prescriptions, e.g., 90 days, to potentially reduce co-pays and improve medication adherence. Patient resources. Be aware of and inform patients about relevant resources, such as patient assistance programs, discount programs offered by pharmacies, or manufacturer coupons. Collaboration with pharmacists. Work together with pharmacists to identify potential medication interactions, ensure patients understand their prescriptions, and explore cost-saving options. The government need to take a proactive role in negotiating the price of medications similar to Australia. Safety and efficacy. Government has a role to play in ensuring the quality and origin of medications purchased online from international sources rather than banning it altogether. Do not forget to click the like button and subscribe. Up above you see another important video related to diabetes medication. Thanks very much for watching this video. Subscribe to my channel.